Hi guys, thank you so much for tuning in. I'm Chantel, your host from Diamond Skins Beauty Podcast. I've got Irari here.
Hi.
And hi, thank you so much for coming.
My pleasure.
So we've got so many questions about people asking about different ways they can remove wrinkles. I know these days we like a pop a bottle open or just pop a cream on and expect our wrinkles to go, instantly disappear. But what if we had a treatment that could go directly to the source of where your wrinkles are and to remove your wrinkles, not permanently, but temporarily? And Hilary has a fashion and wellness influencer, and she's going to tell us about her experience of dealing with anti-wrinkles injections, treatments, and products that she's using that's currently on the market. So take it away, Hilary.
Thank you so much.
So introduce yourself. Tell the listeners who you are and what it is that you do.
I am Hilary Crespo, and I work as fashion stylist to create content on my social media, as well as dealing with wellness and especially anti-age and beauty. It's something I am very interested in, and I applied it on myself every day. I have been trying to fight my age because even though you said I look young, I'm 36. Therefore, I started to prevent fine wrinkles and fine lines and wrinkles when it was approximately three years ago when I started to do some Botox. And then I wanted to try something different, so I switched to radio frequency, microneedling, and then recently to acupuncture. And it has been 1 year I haven't done any Botox because I wanted to try these new ways instead. But here I am, back to where I started, to have a quick fix because it's much needed.
So you said that you did radio frequency.
Yes.
So how many sessions of radio frequency did you do, and what did you do?
Six radio frequency sessions, and I believe they worked for some time, but it doesn't last in the long term. So if you want to see effects from radio frequency, you need to go every week.
Oh, really?
Oh, yes.
Okay.
Every week. The moment you skip a week, you just go there 2 weeks after and you look like you haven't been doing anything for years.
Oh, wow.
So in that sense, sometimes we don't have time to go every week.
It's true.
I don't. I have a busy schedule. I am a mom. I work. I have a lot on my plate, and I cannot allow myself every week to have this time. So I know that Botox worked for me because I previously did it, and for 4 or 5 good months I'm off. Mm-hmm. So this is what I need right now because also it's less time consuming and more effective straight away.
That's true, because it goes straight to the source. Most of the time when people do Botox, anti-wrinkle injections, they typically last between 4 to 6 months. How long did it last when you did it previously?
6 months.
6 months.
Yes. I think it's because my skin wasn't really used to it. So maybe with time you will need it more frequently. But I noticed that because I don't do it very often, it lasts up to 6 months for me.
Oh, that's amazing.
Yeah.
You mentioned in your intro that you did acupuncture.
Yes. And I'm still doing it. Last session, it was 4 days ago.
Okay.
And it helped me a lot because it reduced the fine lines that I had in ear and in ear.
Okay.
So I'm not saying I don't see any result, but when I have a lot of expressivity and I have a strong muscles on my forehead, and I think that's not enough for me, just acupuncture.
How many sessions did you do?
9 I've done so far.
9 sessions. What was the interval between each session?
1 week.
1 week. Oh, so
that's why I'm like enough now. It has been 1 year. I go every week. First radio frequency, then acupuncture, and I don't have time. I'm exhausted. I don't have time anymore. I'm exhausted.
You said you're a mom. How old is your little one?
She's 2 years and 2 months.
Oh, that's amazing.
Yes.
That's amazing.
Yes.
Okay. So every week you went for the acupuncture, and would you say you had good results from your acupuncture?
I think regardless the wrinkles, my skin feels like tight, which is good, and plump. But in terms of fighting the age signs, like the big wrinkles I have, unfortunately, it's not enough.
What about your home care? Does that contribute towards you having, because currently you're not wearing any makeup right now, are you, Hilary?
No,
So
I'm not.
she looks fantastic and she's on
Thank you.
camera. And so you're not wearing any makeup and you look great.
Thank
If people
you.
want to know, like, why is your skin so great? You don't have that many wrinkles considering your age. So what are you doing at home to help it if
I
it's not
have a
Botox?
very good and strict skin routine, cleansing, and then of course apply night serum in the night and day serum in the day, and then moisturize, and then serum eyelashes, and then serum brows, and then whatever serum is in the market, it's mine. And then I also take a supplement like collagen.
Okay, you
Which
take
helps,
collagen
yes,
supplements.
yes, I think
Okay.
it helps. Everything helps. And then in the morning, I use the roller with pink quartz
Okay.
just to have a bit of face gym.
Oh, like the face chip. Okay, yeah.
And then sometimes I massage it around the eyes, the serum. Not massive things, but every little help.
Every little helps.
No.
Most definitely. Most
Yes.
definitely. So your previous experience of anti-wrinkle injections, they lasted 6 months.
months,
Yeah.
yes.
How was the treatment? Painful? Did you use numbing cream?
I didn't use numbing cream, but because I was injected with the smallest needles in the market, so it was bearable. I didn't suffer much, like not a big pain, so very bearable.
So you switched from anti-wrinkle injections to acupuncture and radiofrequency. Was that because of the cost, or was it because you wanted a natural?
No, the cost is actually much higher.
Oh, really?
Botox is the cheapest treatment and is the one that lasts longer.
Oh, okay.
And is the one that doesn't require you to go back every week to the clinic. But because I wanted to try something different, to compare basically. So I was offered, because I'm quite lucky to have collaborations being an influencer. And so I was offered these treatments complementary in exchange of feedback and content, and therefore I said, why not? But if you have to pay from your own pocket, it's really expensive, really expensive. Acupuncture is extremely expensive.
Really? So if people was interested in doing acupuncture, what sort of costs would they be looking at?
Well, considering that you need to do at least one full cycle for it to work, which is 10 sessions, is around £1,000.
Oh, okay. And you have to come once a week.
Yes.
Yeah. In comparison to Botox, which is typically £400-500.
So
Yeah.
so this is I can't cope anymore time-wise.
Yeah.
Because cost for me, as I said, I'm lucky. I don't need to pay that much. But if you can afford it, but at the same time, but you don't have the time, the slotted time to allow to this, then obviously Botox is the way to go.
Yeah, that's fair. That's fair. So, in terms of any other anti-aging products you use, so we've discussed that you've done anti-wrinkle injections in the past. You've done, you use a very strict skin routine. That's why you look
Yes.
fantastic.
Thank you.
And you've done acupuncture and radiofrequency. What about any derma fillers? Have you ever considered doing any of those injectables?
No, I haven't considered. No, maybe because I don't know much about it.
Okay.
So I just, thought I would do what I am familiar with. But maybe if I would have had a consultation with somebody really telling me, okay, instead of this, you should do that, I would probably have done it.
Okay.
I just did not have the chance.
Yeah, that's fine. Because obviously everyone's into different forms of anti-aging, and derma fillers is another way to help with anti-aging because it restores volume loss. So it's never something you've inquired much about.
No, but probably I would consider if an expert would tell me I should do that, I would.
Okay, so thank God you mentioned expert. So guys, so Hilary is going to be doing a treatment with us today. I'm sure she has many questions that she wants to ask our expert. So I'll bring in a fantastic doctor where Hilary can ask some questions that she may have. Hilary, we brought on for you Dr. Ola. She has a master's in aesthetic medicine, and she has 18 years experience doing aesthetic medicine and dermatology in Kuwait and the UK. Dr. Anna, Ilary's here because she wants some treatment regarding anti-wrinkles, and she's got a few questions she would like to ask you.
Yeah, sure. Yeah.
I'm very scared of needles.
Okay.
Would this be very painful?
No, Botox usually is done with like very tiny needles. You will not feel that much pain, and it's a very quick injection as well. So it's a 5-minute procedure. So no worries. Yeah.
Would I bruise?
You may bruise. As long as we are using needles, we may have bruises, but the percentage is less. But we may bruise, yes.
All right. And what do I need to do after the treatment? Do I have to avoid something in particular?
Yeah, you have to avoid exercises, for example. You will not bend forward for 4 to 6 hours. You will not sleep for 4 to 6 hours. So that's the most important things.
All right. So basically quite easy
Yeah, it's a
aftercare.
simple procedure. Yeah.
All right. Okay. Perfect. So I'm scared. Be gentle.
No worries. Yeah, let's start. Yeah.
Is there any contraindications that anyone needs to worry about when doing Botox, or is it okay? Is it a treatment that anybody can do?
Yeah, it's a treatment anybody can do after the doctor consultation.
Okay.
Yeah.
What age generally, because Ilary looks very young, what age generally can someone start doing anti-wrinkle injections?
It's not related to age much. It's related to the facial expressions. So if you are using your facial muscles a lot, you will have a lot of wrinkles. So it's not depending on the age. It depends on your muscle movements.
Is this a preventative treatment? So
Yeah, it is. It is. So if we started doing Botox early, we will not have deep wrinkles later on in our lives. Yes.
perfect. You ready to do your treatment?
Yes.
Perfect. Let's get it done. Ilary, you had your treatment. How did it feel?
Wow, she was so gentle. I didn't feel any needle, and I didn't even use the numbing cream.
Oh my God, that's amazing.
I'm very pleased.
Oh,
Yes.
thank you so much. So typically you do need to come in for a top-up after 2 weeks. Here's your aftercare information with the information that doctors already explained to you.
Okay, perfect.
Any questions, give us a call and we'll see you in 2 weeks just for a top-up.
Perfect. See you then.
Thank you so much for
Bye.
coming. Bye-bye.